Alright, welcome to the CT scan of my abdomen. This time we're going to go through the sagittal view. So right here you can see we have a nice little coronal slice here, but it's showing the different slices that we're going to be migrating through as we move from left to right across my body. So here we go. First off, there's not much to see. Just fat of the thigh and abdomen. We're working on that. And here we start to get the little stripy muscles coming in. So abdominal obliques, maybe a little serratus anterior here, vastus lateralis, but real tough to see anything really important just yet. We move in and boom, we've got some ribs. Nice clear bone right there. You can see a little bit of costal cartilage. There's a transition point right here as we get the rib transitioning to its cartilage. So there's that switch right there. We move a little further in, still abdominal muscle right here. We're going through the different layers of my abdominal musculature. Actually, this is kind of cool. You can actually see it's going inferomedially here. It's my external abdominal oblique. I go a little further in. You can actually see doing 90 degrees to that. So my internal abdominal oblique. It's a nice little detail. And now we're in the abdominal cavity. Now right here, got a nice big solid organ. If we're on the right, it's the liver. If we're on the left, it's the spleen. And I can tell you right now, it's the spleen. Now first off, I knew we were moving from left to right, but even if I didn't, I'd know that the liver should take up this whole space. Whereas here, the spleen is tucked away on the left posterior side of the abdomen. We've got a little space in front of it there. So let's go a little further down and see that we've got some of the small intestine here. So this is in the upper left quadrant of my abdomen, so it's likely to be jejunum. Can't be a definitive on it, but likely to be jejunum. And here, go a little further in, and the spleen's getting smaller. And here, we're picking up some bowel. This is probably going to be transverse colon, transitioning to become descending colon. If we go back the way we came a little bit, we can maybe see it right there, transitioning down. Yeah, so here's transverse colon. We jump back to the left a little bit, and descending colon right there. Now, going down to the thigh, we can see the gluteus maximus muscle right here. Some of the anterior thigh muscles are here, but we can't really spot which one's which just yet. This guy's probably sartorius because of where it's coming from off the ilium there. We'll go a little further in. And something cool is about to happen with the spleen. We keep moving a little bit deeper, and watch the hilum right there. We get a nice big vessel. So we got a splenic artery or vein coming in. Likely the two are traveling very close to each other. So that's happening there at the spleen's hilum. And here, I'm starting to get a little bit of a nice division evident between the abdomen and the thorax. We can see the diaphragm right here, and I'm really briefly going to mess with the levels here. We'll take a look at the lung setting. And right here, everything in the abdomen's washed out a bit, but check out the lungs. I don't have the whole span of it because it's an abdominal CT, but here you can see the markings of my airway and pulmonary vasculature right there, and you can even make out the oblique cleft right there, the oblique fissure of my left lung. Okay, so let's get back to the same setting we were at earlier, and here we move a little further deep into the abdomen. A lot more small bowel coming into play right here. We can see those little squiggly vessels traveling as well. And here I've got two new organs we haven't seen yet, stomach and kidney. So let's take a moment and follow the stomach further to the right. So we've got it right here. It's got some fluid in it, which is interesting. And as we go a little further in, there's some rugae. Picking up a little bit of gas bubbles trapped in there, which is not too shocking. As we go a little further interior, right there, big bunch of gas just before we hit my pyloric region right there. Pyloric sphincter going to be thickening just there. And I was in the hospital getting the CT scan for severe abdominal pain, so the fact that there's some gas in there should not come as a huge shock. So let's go back to the left. Here's the stomach again. Notice that it's going from posterior to anterior, and therefore that initial portion of the duodenum will actually be pretty far anterior. Now right here, we've got the kidney, specifically the left kidney, coming in just inferior to the spleen. So we'll roll a little further in, and we can actually make out in white the cortex, a little bit darker medulla, and the very dark spaces are the urinary spaces. So here we can see that. The ureter is a little bit tough to spot here, so let me see if we can catch it. Right here we can see the renal artery or vein. Can't tell which one's which, but they're both there, leaving to attach to the inferior vena cava and aorta. And this little stripe right here I think is interesting. Let's see if that's the ureter. Let's follow it a little further back. Nope, the ureter is actually this guy right here. So see this little blob just above the indicator? Watch it. We're going to go down, and it's going to get small. The ureter is small. Transition down through there. It's actually going to pass a little more laterally, so you got to back up a little. Follow it further down, further down. And here, spleen, stomach, kidney, and we've got a lot of intestines here. Now the large intestine, the colon, we got the transverse colon right here, and we saw it transition into descending colon. Let's follow it a little bit further to the right. So there's the transverse colon, and as we go a little further along, it's got a nice big loop there from its mesentery. But as we approach the liver, I'm going to bet this guy's going to jump back up superiorly. There we go. And then become the ascending colon along this side. So right there, that's where that transition's happening. So the hepatic flexure or the right colic flexure is there. All right, back it up again. Because we got a couple more cool things to spot. Now real quick, I think this is neat, but you may disagree. But let's check this out. On the inside of my iliac bones, I've got my iliacus muscle, and it's going to join another muscle from deeper in the body, the psoas major. And here it is in all its glory. It's coming from the vertebral bodies of the lumbar and lower thoracic vertebra, and it's this big, big muscle, and it's descending, 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 and it's going to meet up with the iliacus. So here's the iliacus muscle. The two of them are then going to cross the anterior aspect of the pelvis and insert onto the lesser trochanter. It's going to come in about here. So let's watch that muscle go down, 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 and boom, there's the lesser trochanter right there. And it's diving, making a nice sharp angle around the front of the pelvis, giving some leverage to that muscle as it flexes the hip. Again, gluteus maximus here, and gluteus medius and minimus on the posterior side of the ilium right here. Okay, so let's keep on going. As we watch the organs, got a lot of small bowel here. Losing the kidney, there's the psoas major again. So we're getting closer and closer to the midline of the body. Right here, we can actually see the rectus abdominis muscle passing down to the pubic bone, and then up, 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 up to the costal cartilages and lower sternum, xiphoid process. And actually with the costal cartilages, just watch this. This is kind of neat. So here, I jump back way out to the left. Nice big bony rib there. And as we go a little more medially, it transitions to cartilage. So that's that transition from rib to costal cartilage, which will then make it to the sternum. Now, one thing I think is interesting is, look at that. I've got a little bony articulation between these adjacent costal cartilages. So, not something I expected to see in me. So, kind of neat there. So we go a little further, rectus abdominis. We can actually see the separation between its different kind of regions right there. So that's kind of cool. A little further in, and now we're not just going to see gut and organs. We're going to start picking up the major blood vessels. And since we're coming from left to right, the first one we'll see is the abdominal aorta. And so we're going to start catching a little bit more of the vertebra here. Here's the heart, liver, and pardon me, I don't think I actually drew your attention to the fact that we have the left lobe of the liver here, and it's only going to get bigger as we go to the right. So let's actually take a quick moment and watch the liver get huge as we run from the midline to the right side of the body. Boom. Big, big liver right there, and the gallbladder. So here, taking up a lot of space. It's still pretty hefty, even that far to the right side of the body. And as we roll back, we'll just take a moment and enjoy the liver preset here. And you can see its internal architecture a little bit more easily. Some vessels in there, hepatic vessels leading to central veins, leading to hepatic veins. A nice big one right there. Holy moly. And now we'll get back to the midline. There's the vertebra and pick up roughly where we left off. So right here, we've got a great big vessel coming down. And since we're on the left side, the first one we'll see is the aorta. Here it is coming through the diaphragm. And right away, we've got two big important vessels. The celiac trunk going to the foregut organs, and immediately inferior to it, the superior mesenteric artery. And what I want to do with the superior mesenteric artery is we're just going to zoom around a little bit and watch it just scatter into the small intestine and a lot of the large intestines. Just watch that vessel branch into lots of different little twigs. We can follow them all the way out to individual loops of bowel. And it's just a massively, massively kind of arborized vessel that gives off every branch to the jejunum, the ileum, as well as the ascending colon, cecum, transverse colon, appendix, etc. Just really cool vessel there. The celiac trunk is going to be supplying the liver and the spleen, as well as a small portion of the stomach's left lesser curvature directly. Now the other branches of it will supply every foregut organ, but right here, let's zoom back to the left and see if we can actually follow it going to the spleen itself. So here's the celiac trunk. Yeah, I don't know if we're actually going to be able to follow that too easily. It's the splenic artery and vena right there. Follow these guys a little further in. Yeah, sadly I'm losing them. I can't quite make that connection. Maybe right there. We got that happening. But either way, that is where the spleen's blood supply is coming from. And here we can see the aorta traveling down, gives off those two big branches, and here continues going into the abdomen. And right about here, it's actually splitting into the left and right common iliac arteries. So this vessel on the CT scan is not starkly different in appearance from the muscle itself. So here, just watch this artery as it follows the Psoas Major. So here's the artery, and boom, the Psoas Major is traveling right beside it, and it's a little tough to tell the two apart, but I'm going to keep this indicator on the femoral artery as it transitions through the inguinal ligament into the upper thigh, and then down into the anterior compartment to give off various branches there. Okay, that was a little tougher than I thought. We can see the branching of the vessels there. Now we continue to the right, and I'm going to start losing my abdominal aorta and seeing my inferior vena cava. So what I'm looking for is a big vessel traveling along the posterior aspect of the liver, going to the right atrium of the heart. Hey, just before we do that, though, I got one other cool thing to see here. There's my esophagus, head to my stomach. You can see that because it's got a gas bubble in it right there. So let's start looking for that vena cava. And there it is. Right here. There we go. That's the best shot of it. We can see it's transitioning down the back posterior side of the liver. It's receiving hepatic veins from the liver. And right there it's going into the heart. So let's go a little bit further along. So here's the heart itself, and we can see inferior vena cava going into its right atrium and the hepatic veins joining that vessel just beforehand. Very cool. Okay, so a little further along, we're going to see the liver start to take up almost all the space in the upper portion of the stomach. And before we go any further, though, let's take a look at the bones here, because we got this nice big vertebral column to examine. So a lot of muscle flanking it, the erector spinae and transversus spinalis muscles on its posterior aspect. Here we got the vertebral bodies. Let's do a little bit of fiddling around with the presets here, so you can see the bone a little more clearly. So right here we have the sacrum, the spinal canal, got my coccyx tailbone hanging out right there, pubic symphysis right there, and here can see the different vertebral bodies and the spinous processes. Now, one thing I want you to note, because I thought this was interesting, is I got a pretty wedged in intervertebral disc here between my L5 vertebra and my S1. So that correlates with the fact I occasionally get shooting radicular pain along my S1 dermatome. So a little bit of herniation of my nucleus pulposus there. Lucky me. But we go a little further along and we'll see these vertebral bodies start to dwindle, although nice big intervertebral discs hanging out between them. And then as we lose them, we're back off the midline and into the muscles. So here's the Psoas Major on the other side. Oh, before we go on the tour, let's actually see something here. I've never actually seen my own umbilicus. I wonder how deep it is. Alright, right there. That's it. Kind of disappointing, actually. So there we go. There's my umbilicus in all its glory right there. Okay, moving right along. So we go to the right, and here the liver is going to get more and more prominent as we travel through. Here's where that transition between the ascending colon and ascending and transverse colon is happening. And the liver, I can see its large vessels right here. Now the other thing that's happening in this same area is my stomach, its pyloric region, is transitioning to become the duodenum, and that's happening right about here. And the duodenum is going to go back, down, forward to become the jejunum. So we can see that transition here from the proximal first part. It's going to be the superior portion of the duodenum, and then its second or descending part here. Then I need to back up and go back to the left to catch a little bit of its inferior or third portion. Coming out of the screen a bit there. And this real choppy looking stuff right nearby, that's the pancreas. It's not super prominent on CT, but that's the pancreas right there. Its head is sitting in that little groove, little concavity formed by the duodenum. So right there, we move out and there's the head of the pancreas. And let's just take a moment and see if we can follow it further to the left. It's a real tough organ to follow very far, although it will be eventually coming in contact with the spleen, although its tail doesn't always make it all the way to the spleen. So that's the pancreas. It'll be a little bit easier to see on a coronal view, but here it is in this location. Then the duodenum is going to transition to become the jejunum, and that's happening right about here. So that's the transition of the duodenum. Its ascending or fourth portion coming up right there, and when it makes that little sharp bend, the duodenum becomes the jejunum. There's often a suspensory ligament of Treitz or suspensory muscle of Treitz here. I'm not seeing anything that would make me think that. And then we've got the jejunum. And we all have better things to do than for me to try to follow my own intestines all the way in and out of these different sections. So we won't do that. Let's jump back now to our liver. Got our portal vessels, the hepatic arteries, proper hepatic arteries, splitting into a left and right hepatic artery, portal vein, and biliary system, all coming in, associated with the liver right there. And now I'm picking up my gallbladder, this guy right here. And yep, still got my gallbladder. You can see how if it got inflamed or enlarged, it could actually come out here and touch the parietal peritoneum of my body wall and cause some severe somatic pain as a result. I don't know if we can see any of my biliary system. That little twig sticking off the inferior side of the gallbladder might be the best bit of evidence we have in that regard. I'm not seeing anything else that looks like a real clear slam dunk for any of my biliary tree. But now we've got the inferior vena cava here. It's going away as we travel further to the right, and pretty soon the liver is going to take up all the space over here, and we lose pretty much every other organ except for the right kidney. And there it is. One cool thing about this view is we can actually see my right renal vessels right here. We can kind of follow those as they go into, boom, the substance of the kidney there. And we can even see my ureter departing right there. See this little squiggle? So let's follow him a little further down, see how far we get. So I pick up my ureter here. We'll travel a little further down. So there he is. And I lose him right about here. So the bladder is located right here, so it's heading there sooner or later. I don't know if we'll actually be able to see it going into the wall. Probably not. But here, we'll come back to the bladder in a moment. We're going to keep on going to the right. Here's our kidney, or my kidney especially. And it's going away, going away, going away. Here's that ascending colon, and I'm pretty much losing it as we pass out of my body and travel to the right. Now that's pretty good. I want to do one last thing though, belabor this a little further, is right here I've got my ileum, small bowel, entering my cecum right about there. So there's the entry point, I think, right happening there. Go a little further to the right, and we pick up the cecum here. Now, as far as I know, I still have a vermiform appendix, but I'm not seeing him. I do not see my appendix. Maybe that little squiggle right there, but it's hard to say. But I've still got one. I want to keep it that way. But let's go back now. So go a little more here. Here's the ascending colon, transitioning at the hepatic flexure to become the transverse colon. We're going to back it up to the left, and we'll follow the transverse colon here. It's going to loop down over to here as well. Transverse colon has a mesenteric, so sometimes it has a pretty significant dip as it crosses the abdomen. And here it's transitioning into the descending colon. It does so at the splenic flexure on the left side of the body. So here's that transition. We'll back it up a little bit and follow it down along the extreme left side of my abdomen, and then we're going to move to the right again and try to follow it all the way down into the pelvis. Now right around here it's going to get another mesentery, and the descending colon will become the sigmoid colon. Now maybe it's going to loop around in my bowel or loop around in my pelvis a bit, maybe not. We'll see what happens, but it's right here. Got some material packed into it. No shock there. Again, I was in the hospital for abdominal distress. It's not pleasant. But here, it's moving posteriorly, and right there is roughly where we're going to have the recto-sigmoid junction. So here, got the rectum, and this space is going to go down, 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 and right there, got the big receiving chamber. That's the rectum. Go a little further back. And this view is not doing a great job of showing the actual exit point, which is not incredibly pleasant anyway, so maybe that's not the end of the world. But right here, there's the rectum, and just anterior to it, got my urinary bladder. Looks like I got a pretty strong Iliacus there, stretching up towards my umbilicus. That's intriguing. And then here, prostate would be located just here, anterior to the rectum. And I don't think we're going to see a whole lot else. So that's it for this sagittal view of the body. Thank you very much.